That breaking news, in fact, impacting all of North Carolina tonight. Governor Roy Cooper is going to be speaking in about a minute to explain how we start to reopen this state. And as soon as he steps to the podium, we'll bring that to you live.
Remember, the stay-at-home order expires on Friday, and if the governor gives the go-ahead, we'll move into phase 1 of his reopening plan. Want to bring in Channel 9's Mark Becker standing by live. Mark, what should we expect to come out of this?
Well, Erica, it's not going to change a whole lot, but it will make a big difference for particularly small businesses. These are some of those kinds of businesses here in Myers Park. Most of these have been closed down now for at least a month, some 6 or even 8 weeks. And phase 1 of the governor's reopening plan, if he decides to go ahead with it, would allow them to reopen and get other retail business going up and going again. Now, here are some of the main points of phase 1 as it stands right now. Non-essential businesses would be allowed to reopen. Non-essential travel would also be okay, essentially going to shop at those businesses like these. Wearing masks would also be encouraged in public. Now, the governor is speaking in Raleigh. Let's go there right now and hear exactly what he has to say.
In North Carolina, UNC-TV is providing a stream for sign language at unctv.org. As of today, we have 12,256 confirmed cases, 534 people in the hospital, and sadly, 452 deaths. We pray for those we've lost, and we pray for their families. Over the past several weeks, North Carolinians have done hard work, staying at home, keeping a social distance, and wearing face coverings to protect their families, their friends, and their neighbors. The good news is that your work has prevented an overwhelming spike in infections like we've seen in other states and other parts of the world. The harder news is that there is still no cure or vaccine for COVID-19, and the virus continues to circulate. Because of this, we have to be cautious and methodical with plans to ease restrictions. Removing them all at once would cause a surge in new cases, more people in the hospital, and more North Carolinians dying. We have to keep taking precautions to keep people safe. But at the same time, we know we can't stay in our homes forever. We'll now look ahead to the next step for our state and the executive order that ends on Friday. I'd first like to ask Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, to go through today's data so people can see more about testing, tracing, and trends, and the indicators we're watching to help guide our decision. Dr. Cohen.
Thank you, Governor. And thank you for continuing to stay at home so we slow the spread of this virus. You're protecting your family members, friends, and neighbors who are at higher risk for more serious illness from COVID-19. Before I dive into our overall trends, I wanted to highlight some new data we put up on our website today showing how many people in North Carolina are at high risk for serious illness from COVID-19. And what the data shows is that quite a few people in our state, just over half of all adults, are high risk because they are either over 65 or have at least one underlying condition or both. Let me break this down for you in a graph and look at it by age. In this figure, you can look at the darker blue portion. It shows the percent of people in each age group who have at least one underlying health condition that puts them at higher risk for serious illness. You can see that 27% of North Carolinians between the age of 18 and 24, 36% of people between 25 and 49, and 49% of people 50 to 65, and 56% of people 65 and older all have at least one underlying health condition. So you can see the risk is not just in folks that are over 65, but it exists across all ages. And we need to keep that in mind as we move forward. So even as we move slowly to ease restrictions and modify the stay-at-home order later this week, we cannot lower our guard. Okay, So now let's recap the set of measures that we're looking at to guide our decisions and to ease restrictions. It's these same 4 trends and capabilities that we've been talking about for a number of weeks. Those 4 trends are COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Again, these were chosen based on public health data as well as White House guidance. Also a reminder, we cannot look at any one of these metrics in isolation. They all have limitations. And in addition, we have to look at that data in the context of North Carolina. We did something that every state and country is trying to achieve. We flattened the curve. That means we have to look at our metrics a bit differently. We aren't seeing significant downward trajectories on most metrics, largely because we were successful in the first place preventing a sharp peak. We look relatively stable on these metrics that I'll go through, and that's a good sign. All right, let's look at our first metric. This looks at people who come to the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. Our full surveillance report will be posted on Thursday, but here's an early look at the most recent data that shows a continued decline, and that's great news. So I'm drawing your attention to that yellow line. We had a little peak up, and then it's gone back down, so we're in good shape there. Let's move on to the next graph. When we look at laboratory confirmed tests, we're looking at that yellow line again, that is our 7-day rolling average. We see a slight increase, but you can even see towards the right-hand side, it's starting to level. We're gonna keep watching this. And remember, we've been doing a lot more testing. So the fact that we see a slight increase in cases is expected. Okay, next graph. You'll see how the previous graph and this intersects. You'll see the increased testing play out here. The percentage of those tests that are positive, you'll see by the yellow line, is going down, and that's a good thing. So while we're seeing slightly more positive cases with the increased testing, the percent positive continues to go down, and that's good. Next trend. The last is about our day-over-day hospitalizations. And this graph shows that we're largely level and we have the capacity that we need to meet increased demands if more people become ill. Also a good sign. So let's wrap up. Where are we right now? Our surveillance data shows a decline, green check. Currently, North Carolina's trajectory of lab-confirmed cases over the last 14 days, as I said, still increasing slightly, but start to see a leveling there. I'm not ready to give it a green check yet, but we're not seeing spikes. We're not seeing any rapid increases in numbers, but we're going to put an X there for now. Again, we're doing more testing, so we know this number may not go down for a bit. Currently, North Carolina's trajectory in terms of percent of tests of return positive over the last 14 days is declining. Green check, good. So two greens, a red, and on the 4th, we said hospitalization is largely level, and we have the hospital capacity we need, and that is good, so green check. Just a reminder, going through some of our capabilities, the things we've been working on, in addition to the trends, looking at testing and tracing, we're doing twice as much testing per day than we were just a few weeks ago, and that's good. For tracing, more than 4,000 people have applied to the Community Contract Tracing Collaborative, and hiring's already started, so that's great. And then supply chains, with the exception of gowns, are improving, so we're headed in the right direction. We're not perfect, but we're stable. And you may recall that when I first shared these metrics a few weeks back, I said that sustained leveling would be okay for North Carolina. We've never had a spike or a surge, so continued stability in these trends is a real positive for our state and a testament to aggressive early action taken by the governor and your resolve to save lives. So before I turn it back to the governor to walk you through how we're going to take these positive results and now move forward, we want to make sure that we continue to protect our loved ones and our neighbors. We still want you to stay home. And if you're sick, you should definitely be staying home. If you do leave home, we have a new way for you to remember what to do. It's what you've been hearing all along, but now as you think about them, I want you to think about the 3 W's: wear, wait, wash. Wear face coverings, wait 6 feet apart from other people, wash your hands often, wear, wait, wash. All right, those are the 3 W's, and with that, I'll turn it back over to the governor. Thanks so much.
Thank you, Dr. Cohen. As you can see, North Carolina's approach is grounded firmly in the data, the science, and the facts. Because the combination of our indicators tell us that our trends are mostly decreasing or leveling, I've signed an executive order to move North Carolina into phase 1 of easing restrictions. This order begins Friday, May the 8th at 5 p.m. So what does that mean? First, I want to be clear. North Carolina's stay-at-home order will remain in place, but it'll be modified to allow more reasons for people to leave home and to allow for more commercial activity. Phase 1 removes the designations of essential and non-essential businesses. That won't be there anymore. Therefore, more businesses will be open. Retail stores now will be allowed to increase to 50% capacity as long as they can implement social distancing and frequent cleaning. The order allows people to leave home to visit any business that is open, and it encourages parks and trails to reopen. The businesses that were specifically closed in the order we're under right now will remain closed in phase 1. And these are businesses like personal care, such as salons or barbers, and entertainment venues like theaters, bars, gyms, pools, and playgrounds. Restaurants will continue to be open for takeout or delivery only and closed to in-room dining. These are businesses where social distancing is difficult, and they will have the opportunity to open and do more in phase 2 when we get there. Gatherings. We've heard a lot about public gatherings. Gatherings in this order are still limited to 10 people, but people will be able to socialize with friends as long as they're outdoors and they are socially distant. In phase 1, people are still encouraged to telework when possible. And as certain businesses come back online, we know that the need for childcare will increase. And phase 1 will allow child care centers to re-enroll children whose parents are back at work or are looking for work, as long as the centers follow strict cleaning requirements. We are paying attention to First Amendment rights, such as protesting and worship services. Under this order, these activities are allowed outdoors with more than 10 people, as long as there is social distancing. There is still significant concern about gatherings of more than 10 people indoors, particularly where people are standing or sitting near each other for more than 10 minutes. The chances for spreading the virus are significantly greater in these circumstances. Phase 1 in North Carolina is a careful and deliberate next step. We have flattened the curve, but we hadn't eliminated COVID-19. We'll continue the stay-at-home order because it's still best for people to stay at home, especially those with underlying health conditions. And when people do leave home, we want folks to remember the 3 W's: wear a face covering, wait 6 feet apart from other people, and wash your hands. Cloth face coverings like we wear here in the EOC, the Emergency Operations Center, can be simple and homemade. The main purpose of a face covering is to protect other people in case you have COVID-19 and just don't know it yet. This protection works best if you also wash your hands and wait 6 feet apart from other people. This order that I've signed today It'll take effect on May 8th, and it is set to expire on May 22nd. But if our indicators are not in the right place, we'll extend phase 1 longer than 2 weeks. We are easing restrictions in a data-driven way. Now, I know people are eager to work and eager to play, but I know that people are also worried about how this virus could affect them and their families. Feeling that impatience and that concern at the same time is difficult and confusing. Phase 1 is designated, and phase 1 is designed to be a limited easing of restrictions that can give people safe opportunities to socialize and boost parts of our economy while keeping important safety restrictions in place. You know, we can only boost our economy when people have confidence in their safety. Fighting this virus requires all of us to do our part. I've seen countless stories of North Carolinians looking out for each other as we work to make it through day by day. In fact, whenever you stay home or sanitize a grocery cart, go out wearing a face covering, stay physically distant, you are looking out for your neighbor. These stories about people give me hope. They remind me that even though we're not physically together often, we are still in this together. In addition to Dr. Cohen today, we're joined by our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Connie Jo Hutchinson are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We're now going to take questions from the media. We'd ask you to identify yourself first and then state the name of your organization, and all of us here will be available to answer questions. So we'll take the first question.
Our first question will be from Ken Smith, WRAL.
Good afternoon, Governor, Dr. Cohen and others. Ken Smith with WRAL. As we look to move into phase 1, what most concerns you?
I'm sorry, can you guys turn up that volume because I did not hear that? Can you try that?
Can you try that again, Ken? Sorry about that.
Sure, no problem.
I heard it was you, but I didn't hear the question.
As we look to move into phase 1, what most concerns you? Because last weekend we saw when some of the coastal communities opened their beaches, people flocked to those beaches. A lot of people were not practicing social distancing. So as you ease restrictions starting on Friday, what most concerns you?
Yes, what would concern me is that the people begin to not take this seriously and not be concerned about the safety restrictions that we need to make sure that we have in place. That's why it's important for people to remember that we are continuing the stay-at-home order. We would rather you stay at home. But we also know that people do want to get out. We do want people to go and visit their physicians and go to the hospital to get needed treatment that they may have other than COVID-19. And we need to give a boost to our economy. And we have examined this carefully and believe the data shows us that now is the time to begin easing these restrictions, and we're doing it cautiously and carefully. And I think for the most part, even though you see sometimes people not paying attention, and those are glaring often, for the most part, North Carolinians have been pretty good about observing social distancing and staying home as much as they can, and that's been evidenced by the fact that we have flattened the curve. So I'm very hopeful as we enter into phase 1 that people will continue to be careful and that we can give a boost to our economy and that we can continue to move through these phases in a safe way, giving people confidence. Thanks for that. Next question, please.
Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. Are there plans to appoint a particular committee or task force that will be responsible for enforcing the protocols that you've laid out in your executive order for these businesses to reopen. You've talked a lot about the importance of consumer confidence in this process, so just how can we be sure that a business is complying with the safety measures you've laid out? Thanks.
Thanks. For the most part, businesses have been strong in their response, trying to protect employees and also trying to protect the customers in their stores. And we expect people to follow these orders. And for the most part, businesses have been very interested in them and have worked hard to try to comply, as have everyday North Carolinians. These are still enforceable by local law enforcement. It is a misdemeanor to violate the order. And most of the law enforcement officers around the state, there have been some arrests, but most of the times they handle this thing by telling people, hey, this is a violation of the order. Please don't do this anymore. And it usually works out. That's the way we want this to happen. We want people to be in this together, look out for each other, try to follow these rules, because that's going to get us where we need to go, both with keeping people safe and helping to boost our economy. Thanks. Next question.
Jonathan Alexander, News and Observer.
Hi, this is Jonathan Alexander with the News and Observer. I have a few questions. How is the timeline coordinated with other states? You mentioned before that you were going to talk with Georgia Governor Kemp. Just wondering what the result of that conversation was, and the conversation with, or whether there were any conversations with Virginia Governor Northam. I was also wondering about summer camps in sports, and whether there was any updates on when that might occur.
Thanks. We are concerned about what happens in other states because the virus doesn't respect state boundaries, and I have expressed my concerns to the governor of Georgia regarding their opening of more businesses than North Carolina is opening right now. We're concerned about how fast they are moving. We hope that that turns out well. We hope that more people don't get sick, and we hope that it doesn't result in a downward trend of, or an upward trend of having more cases. And we're continuing to work together as governors to make sure there's more testing and tracing and taking good ideas from each other as well. Summer camps, day camps are allowed under this new executive order as long as they follow the CDC guidelines. There will not be overnight camps this summer due to the order, but day camps are allowed, and Dr. Cohen has provided with the Department of Health and Human Services the CDC guidelines that these camps have to follow. Thanks. Next question, please.
All right, you've been listening there to Governor Cooper making the announcement, if you're just joining us earlier, that North Carolina will go into phase 1 of the reopening stage on May 8th, that's Friday, at 5 p.m., allowing more stores, Erica, to be open, retailers to go up to 50% capacity. And all this is based on those 4 key indicators they looked at. And 3 out of 4 had a green check, a positive trend. 1 leveling off, but not quite yet considered green. But what the state believes it needs to see to enter phase 1 on Friday.
That's right. A big thing. You said retail stores going to 50% capacity. Restaurants, though, still closed for in-room dining. Child care can increase. Those centers can increase. Well, they follow strict guidelines. They can reopen, though. And then parks and trails, people can go out to visit those. Just some of the highlights they hit. But still, the salons, barbershops, theaters, bars, gyms, pools, playgrounds, all still closed. Want to go to Channel 9's Mark Becker, who is standing by. I know, Mark, you've been talking to a lot of people out in the community from different sectors. What stood out to you as you were listening to the governor's remarks?
Erica, I think a couple things, right? First thing the governor said right off the top, we have flattened the curve. That is something we've been hearing for a long time as an objective. Now he says we have flattened the curve, avoided that huge spike. The other thing, when he talked about the reopening, he talked about measured and very deliberate and intentional, careful, cautious reopening. So here again, is phase one of his reopening, as it would affect particularly small businesses here. That is to say, number one, non-essential businesses would be allowed to reopen. That includes a lot of small retail stores. Non-essential travel would also be okay, as in going to shop in those businesses that will now be open as of Friday at 5 p.m. Wearing masks, though, still encouraged in public. Social distancing would be enforced inside those businesses. That 50% capacity, that 6 feet distancing, certainly being enforced. And it also encourages, whenever possible, people to work remotely. Now, I've spoken with the owners of a couple of businesses here who are excited about getting to open again on Saturday morning. They say they will be enforcing those social distancing and limiting the number of people rules about going inside their businesses, but they're ready. They say they needed it. We'll have more from them coming up on Eyewitness News at 6. Erica?
All right, Mark, thank you. Again, phase one would start this Friday. It would last for 2 weeks and end on May 22nd if everything goes well. And then would come phase two. That would lift the stay-at-home order and allow restaurants to more fully reopen. 4 to 6 weeks of that without major setbacks, and then phase three could kick in, increasing the capacity for, say, at churches, other restaurants opening broadly, and other businesses. As state leaders plan the reopening, Reopen North Carolina protesters again held a demonstration outside of the General Assembly. About 100 people listened to speakers talk about why they think it's time to reopen and repeal the stay-at-home order fully. News crews there at the rally saw at least one person taken into custody by the police.